Laura, we got to know each other through your involvement with the Manchester Optom training programme. It's an unusual or different way of becoming qualified as an optometrist. Perhaps you could tell us a little bit about that.
So the Optom is a 4-year undergraduate programme offered to 4 students by the University of Manchester, and at the end of it you graduate with a Masters in Optometry but also becoming qualified as an optometrist, so you don't have to do the usual pre-registration year post-graduation. One of the great things about it is that you get to spend 12 months in practice, so I got to spend 6 months at BBR Optometry followed by 6 months at a hospital setting afterwards.
Now, the practice has a very interesting element of optical correction, and you were actually our first person to take part in that. When you were a placement student here, and you've gone on to continue wearing contact lenses in that mode, and you've actually our #1 contact lens fitter for overnight vision correction. Perhaps you can tell people a little bit about overnight vision correction. What does it involve?
So overnight vision correction, or orthokeratology, is when you wear a contact lens overnight, and then that means that you can be spectacle or contact lens free throughout the day, which is great for patients with certain professions or if they do things like sports. It's also great in reducing down the progression of short-sightedness or myopia. So it's great for children, and we do fit a lot of children at the practice, especially those who are starting out wearing glasses or who have seen an increase in the prescription recently, or with certain risk factors such as both parents being short-sighted.
Are there risks as well as benefits in overnight vision correction?
Yes, so the lenses, you have to clean them very intensely because you wear the same lens for 6 months. So the cleaning and hygiene has to be to a high standard.
And do you sometimes find that children are a bit better looking after their lenses than adults and keeping them clean and being compliant with instructions?
Yes, usually.
Okay, that's often the case. So are there particular people that orthokeratology, overnight vision correction, wouldn't be suitable for? Are there particular people that you could tell us about?
So at the moment it's only suitable for people who are short-sighted and within a range of prescriptions. Also some people who might have irregular sleep patterns, because you do have to wear the lenses every night. So for example, people who might do shift work. Also if you have certain eye diseases, especially affecting the front of the eye, so especially affecting things like the cornea, but the optometrist can always advise you whether you are suitable for the overnight lenses.
Now, one of the other elements that's enhancing your clinical skills is becoming qualified in independent prescribing. So perhaps you can give us a little bit of a brief on what that's going to do and how you go about becoming qualified.
So to train to be an independent prescriber, I'm spending 12 months doing theory with the Aston University, and then I go on to a placement at the hospital where I'm working alongside ophthalmologists. But also we've got independent prescribers like yourself in the practice that we can work alongside and get the advice and experience from that as well.
And the new refit has given us an additional capability of offering a new consulting room suite specifically for emergency patients. Do you think your independent prescribing will be beneficial from that point of view? So
with the ability to prescribe independently, it would stop the patient having to go to A&E or have to wait by their GP to prescribe eye drops, so we can prescribe that in practice, and it's a lot easier for the patient and it avoids the waits as well, but also reduces the burden on the hospital.
And finally, I think you've got a little bit of news to share with the audience, haven't you? Congratulations, Laura, and thank you very much.
Thank you very much.